Good afternoon. So my name's Magda Dudziec and I'm a researcher on this project, this innovative project called Access to Wellbeing. It's looking at increasing activity, wellbeing and quality of life and dignity in a residential care setting. So the work has been done in collaboration with Wandsworth Council Social Services, Kingston University and St George's, and obviously the South West London systems, and also not forgetting a logo that should be up there but is not there, is the Integrated Falls and Bone Health team from St George's Hospital, which is based at St John's Therapy Centre. So just to give you a little bit of background, there are roughly 750,000 people who reside in care homes in the UK. When people leave their own homes and enter residential care, the aim is for them to maintain as much independence and health and to live as rewarding lives as possible. For all of those factors, physical activity is incredibly important. So in order to maintain independence, physical activity is a must. However, regardless of the reputation or the perceived quality of an establishment, sedentary behaviour is the most commonly seen behaviour. So often you go in and people spend most of their days sitting down. Another factor within the residential care homes is the fact that staff are often very transient. So they don't stick around for years and years at a time, and often they are agency staff. They're very busy, they're largely untrained, and the approach within residential homes is for staff to care for rather than encourage independence. And that's something that we want to be addressing with this programme. So carrying on, the previous slide was also rationale, but this slide is a little bit closer to the actual project. So back in 2010, the Falls team that I mentioned at St John's Therapy Centre observed a need for a change of approach in a daycare setting. So they observed a lot of sedentary behaviour and a setting which wasn't really providing meaningful activity for people within a daycare setting. So they looked at ways in which this could be changed and formulated a programme which we're going to refer to as Access to Wellbeing. And that was started in August 2010. At the moment, that programme, I'll go into the components of it in greater detail in a couple of slides, but that programme within the day centre is running virtually independently right now, and has been running with really great success, which is feedback that's been received from staff and residents alike. And there's a report that we're currently in the process of completing, which we're aiming to get published, detailing the successes of that story. So the question came about approximately a year ago with regard to whether the success within a day centre can be transferred into a residential care setting, because the same problems were identified within a residential care settings of a sedentary behaviour and a behaviour that's not really helpful with the outcomes of the service providers. So a care home was identified with management who were keen to be involved, and that's where the access to wellbeing within a care home setting sort of starts. So just to kind of give you a little bit of an impression of what access to wellbeing it is. So it's a whole systems approach to create a meaningful and active environment for care home residents. So by a whole systems, what we're looking at the organisation as a whole, with the resident at the centre. We're also looking at work practice, and we're also looking at the environment and whether that is helpful to create this active environment. So essentially the resident is at whole. This should really be a diagram, but apologies, it isn't. So the resident should really be at the centre, and the organisation is whether it's catering to them to enable them to become as active and meaningful in their participation in life. So a lot of talk about activity. There's already been another group who's mentioned how important activity is. So this slide is really talking about inactivity and the cost of inactivity. So an increase in falls, a subsequent increase in hospital admissions, decreased quality of life, depression, increased dependence, an increase of non-communicable diseases, by which I mean diabetes, obesity-related and inactivity-related conditions, and of course an increased carer burden. All of these can also think about the increase of cost which an inactive elderly person is contributing to society. So the question really is how it will be done. So this is a work in progress to start off with. So this has been implemented really successfully within a day centre setting, but we're talking about transferring it to a residential care home, which is a different group of people. Not wanting to use the wrong terminology. So it's a different group of people, different environment, a completely different set of standards that we're working to from the care home setting. But to start off with, we're thinking of where the plan is to create some detailed assessments of the residents, the environment that they live in, and the staff interaction within that. And by detailed, I mean really comprehensive, detailed assessments. So not something that would take a couple of hours, something that would take a long time. And from that, we're looking at suggestions of changes that will help improve and make these factors work better for the residents. Environment is a huge a component to this, because the way in which the area, the space is laid out can have a profound impact on somebody's ability to interact with their environment, to be active, to participate. And also, of course, staff is a really key factor within this. So staff, I've mentioned, are transient. So by increasing their education and their awareness and really enabling them to get to know the residents that they're working with and to create a pride in their work, we're aiming to kind of increase work satisfaction and potentially retain those people in their roles for longer. There's also a suggestion of one of the pillars of access to wellbeing is a champion system. So by champion system, previously a lot of the staff the staff were responsible for all the staff were responsible for all the residents. What we're suggesting is a champion system where one member of staff is more responsible for 3 to 4 residents, and they work with those residents to work towards goals. And this worked fantastically well within a daycare setting, and we're hoping that it will translate really well into a residential home as well. The last sentence on this slide is one small sentence, but a huge factor. So I've mentioned the culture of care homes as almost the staff are doing things for the resident, and it's almost like they are waiting upon them and providing cups of tea, helping them do this and helping them do that. What we want to switch is to create an environment where the staff are empowering the residents, the staff are encouraging independence. So that's a very small sentence, but actually a mountain to climb, because it's really switching mindsets radically. So I've got this slide here is illustrating several of the changes that we are looking to implement, and some of these have been implemented. So some of these photographs, I have to apologise for the quality because they're taken with my mobile, at some of the centres, the day centre that this was implemented in. So we've got activity-specific areas. We've got increasing activity really a priority, tailoring activities to the individuals that they should be tailored to. So not board games. If board games aren't specific for this population, it's really assessing whether this group of people are doing the correct activities, and if not, then changing them so that they are the right activities for them. And in the bottom right corner, we've got evidence-based, dementia-friendly layout and decor. So this is really important, that it's based in evidence and that it's providing as good an environment as possible for these individuals. So the objectives of my work and our work with the South London systems is to look at at how this works and why it works as potentially an effective intervention. We might find that as we proceed, the environment is so different to a care home that there may be huge tweaks that we need to do. But essentially, we're trying it out and seeing whether it works or not, because it worked really, really well in a daycare setting. But let's see what happens with regard to this one. The basis is very good, so we're going for it really to see how it works in this setting. Also, the aim is to provide reports and documentation that facilitate wider implementation, because we feel that it will be a really good idea within this setting, and also to disseminate that information to interested parties. Right now, where we are with regard to the progress with access to wellbeing in a care home setting is the assessments have been completed, and we're at the point now that we're starting implementation of them. So we're really at the beginning stages, so we are just almost starting the project and waiting to see how it will develop. And that's the acknowledgements. Obviously, I've not mentioned it, but I shout out to the South West London Systems and thank you for your support.